Good afternoon. This is Delane Henry. Welcome, everybody. I appreciate you guys joining us for today's webinar. I'm going to just introduce our company again for anyone who's joining us for the first time, and we'll give a couple of minutes to those still signing in. So again, I'm Delane, and I really appreciate everyone signing in. We have some great information from Medicare and some new OIG information about their 2017 work plan. I think everybody will find that interesting. So advanced hospice management is hospice only, third-party independent billing solution. Our billers are geographically dispersed, which is really great because it allows us to hire from the best and brightest of the pool of billers in our country, which has given us a tremendous team. And I think that you would find, as our clients do, that we do a great job with billing, and we have a dedicated biller to each account and a backup biller, which gives you the redundancies that you never worry about your biller being out sick or out unexpectedly for any reason, and that your billing would fall behind. Our company has a 24-hour emergency hotline for our clients, which gives you access to your billers virtually any time that you would need them. You know, our customer service is second to none. We continuously educate our billers, and in fact, we share a lot of that information with you guys over the webinar. We maximize collections for our clients. And again, our billers are trained and experienced, and I think that's what really sets us apart. So if anybody is in need of a billing solution, please contact us. We're very happy to help you guys in any way we can. So today, we'll cover three really important aspects of new information that we were given. We're going to talk about, again, new exceptions for late notice of election, the OIG 2017 work plan, and also we're going to revisit something we talked about last month, which was the election statement that Medicare finally issued for us, a sample hospice election statement, which is the statement that your patient signs when they elect the hospice benefit. So first up, we'll talk about MOM Matters, which is SE 1633. It was put out in December of 2016, and it gives us, if you guys remember initially, we were only given 4 reasons for a late notice of election to be overridden and appealed. Basically, they said, you know, here are your 4 things, and they were things like natural disasters and newly certified Medicare agencies, previous hospice, blocking your billing. So really, they were things that didn't give us any leeway at all for any kind of error, or even a typo just wasn't acceptable, and we just had no room for error at all. So this new guidance from Medicare gives us a little bit more of the leeway that we need for things like that. I mean, when Medicare doesn't accept a notice of election electronically, you have another set of room, I guess is what I should say. You have a whole another layer of room for error, and those things are now accounted for in their exceptions. The OIG Work Plan will talk about the hospice conditions of participation, and particularly the registered nurse requirement and updating of the plan of care through the interdisciplinary meetings. The CMS hospice election statement, again, I did some research and got some input from some other consultants about that form that Medicare put out, and we'll talk about that as well. So SE 1633, timely filed notice of elections with inadvertent errors that cannot be immediately corrected due to Medicare systems are considered out of the control of the provider and thus qualify for an exception. So let me talk about that first. When they say that it's an inadvertent error that's out of our control, that is really, I think, subject to interpretation, and we will get that interpretation from our MACs, which are Palmetto, CGS, NGS. So we really want to understand what they're saying to us because they're giving this instruction to the MAC. So one of the things that they say is that your notice of election is entered timely, but you made a mistake. And the notable mistake that they discuss as an example is a transposed or incorrect Medicare number. So you're typing in the Medicare number for the patient, and you transpose two numbers. What happens is that number goes into the Medicare system, and Medicare starts to process that notice of election, and it doesn't find that Medicare recipient in that particular region. So it goes out into every other region of the country before Medicare finally says, okay, we've exhausted all of our Medicare recipients and we do not find this number. So they send it back to us RTP, return to provider, meaning there's an error. But for it to go through all the MACs takes days and days and sometimes weeks. So what was happening is if you make a typo in a Medicare number on a notice of election, you can watch it every day and it sits in suspense, you're watching it, and then it comes back to you in an RTP status on day 15. And up until this point, those were not subject to appeal. That was considered a provider error, and we were just out those 15 days and had to refile a new notice of election. So we really have to read what they're saying in this entire document, SE 1633, make sure we understand the exceptions they're giving us and make sure we follow their rules. So the MACs have been instructed to grant exceptions if we can produce the following documentation: when the original notice of election was submitted, when the notice of election was returned to the provider for correction, and when the notice of election was resubmitted by the provider. Now, instead of providing all of that documentation, and you will find that some of the MACs, and I believe NGS is most notably the one that will want that non-medical ADR, so to speak. When you have a notice of election that's late, they actually want you to send them all of those documents so they can see the work line, the timeline, and how you put all of your information in sequentially and all of those things. Whereas some of the others, like Palmetto, will look at your remarks first and will consider your remarks, and if they can substantiate what you're saying in your remarks without documentation, then they will not require a non-medical ADR. So I think the MACs just all work a little bit differently, and you really need to know how your MAC works and what they will expect. But again, all of us should have documentation on any of these, and we should make sure that we are aware and we know and have in print when we submitted a notice of election originally, so we can show we submitted it timely. The remarks, again, must indicate the circumstances and time frame in order to be considered as a valid substitution for documentation. And if you don't put good remarks, I can tell you that the MACs will require you to provide your documentation. Sorry. So another instance here is, and I was very surprised to see this one, they're telling us that if we make a mistake on an admit date, so we enter the notice of election and everything is correct, but we've entered the wrong admission date, and it happens. And I know that sometimes it's just confusion as to when the true admit date is. Was the patient really referred on a particular day and then admitted the next day? I mean, sometimes there's a question, and it may have to do with signatures face-to-face. It may have to do with a lot of different things involving the physician or the discharge from the hospital. So sometimes you take a referral, you put your patient in your software system, and then the patient doesn't come out of the hospital the day you expect, or there's some delay in the nurse seeing the patient. There's just a lot of reasons that your admit date, you may think it's one thing, and then you may find out after the fact that it actually was a later date. So what Medicare says is that is now a reason for appeal. So if you enter the wrong admission date and you put your notice of election into process, there's nothing wrong with it. It will process, but you can't correct it until it goes all the way to process, and then you have to cancel it with an 81D, and then you have to wait for that to process, and then enter the notice of election with the correct admission date. So that, again, was surprising to me that they would give us that exception, but they have. So, again, what they're telling us is that the MAC will grant us this exception if we have all the documentation to prove what happened in the instance that we entered the wrong admission date, and we have 2 business days to make corrections, which means when your notice of election goes to process in a B9997 status, which is a final status, you have 2 days to enter that 81D to cancel that notice of election. And then you have to monitor that 81D, and you have 2 days to when it processes to enter your new notice of election with the correct information. So it's really important. This doesn't give us any leeway here that we can relax when it comes to notice of elections and timing and things like that, because whatever our errors are, even though we may be blocked by Medicare's constraints, they are still holding us to monitoring these daily, knowing when they finish processing and get into a final status, and making our corrections timely. So I think that's just as important, and obviously they're going to watch these closely. And if we can't show that we have absolutely followed their rules, then they are not going to grant the exception. So we've given, they've given us a little bit of breathing room, and as appreciative as we are for that, I think it really just gives us more room for error on the back end if we're not watching these closely. So we want to make sure that we're still looking at our notice of elections daily as they process through the Medicare system and monitoring those and checking them for errors, because again, if you there's a scenario where if you enter a wrong Medicare number and you monitor that claim and you're seeing it in S and seeing it in S, and then you realize it's the wrong number, you have to make a decision. If it's within the 5 days, you can enter a new notice of election with the correct number and you won't have a late notice of election. But if it's outside of the 5 days and it hasn't gone all the way through the process yet to get to a final status where you can correct it or enter a new one, well, how is Medicare, how are the MACs going to respond to that if you find your own error and your original notice of election hasn't processed? So that is an issue we have not come up against yet, and we'll document if we do and when we do what the MACs will expect us at that point to do. I mean, to me, it would be the right thing to enter a new notice of election with the correct information as soon as you discover your own error. But if they're saying that they want that initial notice of election to process all the way through first so that we get notified that, oh, you have a mistake, then are they still going to grant us the exception if we file on our own and discover that error on our own prior to the final status? So that's something that I will ask about on our NGS group call, and I'll see if anybody has either experienced it or if NGS has any guidance for us. But I'm not sure. That's a question still, so everybody just really needs to be aware. But if you have not downloaded the MLN Matters SE 1633, I would most definitely download and make sure everyone in your agency has read it and understands it, in particular your billers, intake. There's a lot of other details that you definitely want to be familiar with. So our next subject is the OIG Work Plan for 2017. And this is the Office of Inspector General. And the Office of Inspector General is kind of like the Medicare police for hospice, which is really a very loose way of putting it. But basically, they give a work plan and they say, these are the areas of interest that the OIG has for these particular Medicare providers. So for hospice, this year, there's a couple of different things that they will focus on. They've restated that our hospice benefit is supposed to cover virtually all of the care of a beneficiary, and that there should be very few instances where there would be something non-covered by hospice, and we get into the related and non-related issue with that question. So I don't want to go all the way into that, but because they've already told us that they expect us to code the diagnosis for the terminal condition, any related conditions, and now they're saying even any unrelated conditions, because they want us to look at the patient as a whole. That is where, they really are going to look to us to define what's hospice related and what's not, because I do know that the reports are still showing that there are so many claims outside of the hospice benefit for patients who have elected the benefit that Medicare is still looking at that, because it's like the patient is getting double care when they elect the hospice benefit, and it's supposed to be palliative care only. There's still a gray area where patients are seeking other care, and Medicare is trying to rein in that expense and have the patients and the beneficiaries follow the hospice benefit if that's what they choose, and not to step outside of that coverage. Obviously, those are still costing Medicare quite a bit. The OIG will also identify whether or not providers are scheduling visits, and this was a big deal, for the registered nurses at least every 2 weeks to oversee the interdisciplinary team's adherence to the plan of care. And this is something that we've seen with ADRs and other types of audits, where if as a provider you get an ADR and you're sending in only the IDT meetings and the updated plan that happens within that month, then they're denying any days that fall under an IDT meeting from a previous month, or that fall after the expiration if you didn't include them all. So the OIG is really looking at whether or not we are updating our plans of care, following our plans of care, and again, I think the primary underlying theme here is documentation. They want to know that we're sending enough of a skilled nurse out to make sure that the patient's needs are being met, and that they're being identified, and that they're being discussed and entered into their plan of care. So again, that's an important part of not just ADRs, but DPICs also, and that's what I'm talking about with the denials, is that a lot of agencies are seeing denials in audits for those reasons. So we want to make sure that we're including all documentation that pertains to any care given in that 30 days, whether that meeting fell within the 30 days or not. And then the last thing we'll talk about is the CMS Hospice Election Statement. And this is something we covered last month because Medicare actually finally, at the OIG's suggestion and prompting for several years, Medicare finally gave us a sample hospice election statement for the patient to sign. And Medicare gave us some guidelines for those elections, and they actually updated those in 2014. And they said that all of the hospice election statements should include 7 particular pieces of information, which is it identifies the particular hospice that will care for the individual. It identifies the acknowledgement that the individual has been given a full understanding of hospice care, particularly that it's palliative rather than curative. The individual representative acknowledged that the individual understands that certain Medicare services are waived by the election, the effective date of the election, the individual's designated attending physician, if any, and that it should include the identifying information for that physician, including the MPI, the address, all of those things that would clearly identify the physician. The individual's acknowledgement that the designated attending physician was the individual's or the representative's choice, and the signature of the individual or the representative. So that's what Medicare says we absolutely have to have on an election statement, and that any election statement not including this information would be denied in a review situation. Now, after reading some other thoughts from other consultants and even some attorneys about this election statement, it was brought up that the election statement did not include the patient's right to revoke the hospice benefit at any time. So in reading what Medicare requires, this election doesn't require that we have that data in it, and it looks to me like that is more of a patient's right that maybe is on a different document depending on how you guys, inform consent. If your forms or whatever your signatures that you require from your patient on different documents in your admission packet, and those things that are part of your hospice admission would include, of course, informed consent. So maybe where that information lies is in just a different document for your particular agency. It just seems to me, though, that we could include that statement, that the patient understands that they have the right to revoke the hospice benefit at any time, somewhere within this Medicare hospice statement. The draft sample that they gave us looks like this. So if I were designing it, I think I would add to the effects of a Medicare hospice election in that section, I would probably add just another sentence that says, I understand that I have the right to revoke the hospice benefit at any time to seek curative treatment, or however you may want to word that, would resolve some of the issues that other professionals in the hospice industry have brought up about this statement. Now, like I said, again, depending on how your other documents are drafted, you may have this information on an informed consent, on other documents in your admission packet. So maybe it's there and it's just not on the election statement. But I think for the 6 or 7 points that they're requiring, it certainly wouldn't hurt to add that 1 point to your statement and make it complete and full, and all of these things that your patient is acknowledging that they understand would be all right on one piece of paper, and you would have that signature. So that covers everything that we have today. I'm going to just take a minute and look through the questions if anybody has questions, and let me see if I can find those questions, and I'll be right back to answer them. Hold on. Okay, so I actually only have a couple of questions, and they both pertain to the slideshow. And will you have the slides after the presentation? And absolutely, we will send out this set of slides to everyone who attended. And if you notice, there are links to these, like the election statement and all of our OIG work plan. We've given the links to reference everything that we've talked about, your election statement, and I included the CGS election statement because this is where I found an older version of an election statement, again, put out by CGS and not by Medicare. CGS is a MAC, and it did include the information about the option to revoke hospice at any time. So I thought that these two documents together probably give you everything that you need to have a full and complete election statement according to Medicare guidelines, and also includes some of the other informed consent. So yes, we will definitely send it out. We'll send out the slideshow with the links so you can reference everything that we've talked about. The original subject we talked about was the SC 1633, the MLN matters regarding the new notice of election appeals reasons. So that's also noted, and you'll be able to download that from Medicare. So everything is available here. We'll make sure every attendee gets this slideshow. And if there are no other questions, I'll wrap it up for today. Again, we're available. If you guys have questions, you're welcome to email me. I think, let's see if I can find my slide. Apologize for that. So you can email me at dh@hospicemgmt.com. You can call us at the 888-737-3585. If you have questions after you receive your handout, or there's something that maybe isn't very clear, I'll be happy to discuss it with you guys. Send me an email, give me a call. We'd be happy to hear from you. And if anyone has any subject matter that they would like to see us cover on our webinars, I would like to hear those suggestions as well. We want to give you the information that you guys find most helpful. And so if you have suggestions or are unclear about anything regarding hospice billing, for regulatory and compliance, we can certainly consult with our experts on that information, and we'll be happy to relay that information in a future webinar. So again, thank you everyone for attending, and if there are any further questions, shoot me an email, and I think you will still be able to enter them here for another minute or so, and we'll make sure to get back with you on that. So everyone have a great day. Thanks again, and I'll see you next month.